In this session, we are going to review just a general overview of the EMR portal. To begin, we're going to navigate to the bottom left of our screen and select EMR to open up the EMR portal. Once in the EMR portal, you'll first want to select which schedule to view. You have the option for office schedule, and if your practice utilizes hospital and/or dialysis rounds, you also have the option to select to view those schedules. For this training, we're going to focus on office schedule. So I'm going to use that drop down to open up my options. The first option is the resource. So if I click on the pencil, I will open up the window that allows me to select the resource or resources that I would like to view their schedule. Once you select your options, hit the save, and then close this window. If that resource has any patients on the schedule for the day on the calendar you're on, the patients will then display. Once I've selected my resource, I will next want to select my appointment display options. That would be the items that will display when viewing any of the appointments in the EMR. The options are to display the chief complaint, the appointment status, the room status. Only checked in will take away any appointments that are not checked in and only view appointments that are checked in. If you look at the schedule, the first patient has a green check, and also you can view that the appointment status says checked in. Based on that, the others are not checked in. If I select that option, then I will only be seeing the patients that are checked in. It's also helpful to see the time the patient checked in, the super bill and soap note status. You can also select to auto refresh the screen as patients are being checked in or checked out. It will update any of those statuses as well as any patient newly added to the schedule will automatically refresh. And if your practice does have the intelligent intake, you might want to view the status of that patient as they're completing their intake. To open the patient in the EMR from the schedule appointment, simply click on that patient and it will open up their patient's EMR chart. If you notice, the left sidebar will turn into a bright green, indicating that that is the patient that you have open up in the EMR. Always open scheduled patients from the EMR appointment list by just simply searching for a patient. That will not link back to their scheduled appointment as far as their super bill and their soap note. There are some additional tools that you can utilize from the patient EMR list. Up here, you'll notice that it will indicate the number of patients that are checked in. I can also, from the patient's appointment, click on the gender sign, and that will allow me to assign a room and a status to the patient. Simply hit save and then close the window. There are several options up here on the menu bar. The first is details. I can navigate from the details, which is the timeline, to the history view. I also can open the patient setup from this screen by clicking on the word patient. Or I have many drop-down options from the patient drop-down. From the More menu, I can select to print, and that would bring up the patient's face sheet. So I can print the face sheet from here. At the top right of the screen is the patient display area, so I can see the details of the patient, including their birth date and their gender, or I can hover, and that will show me additional information as far as their primary insurance and secondary insurance, and whether or not they are connected to the MML. This icon here will also indicate whether or not the patient is connected to the My Medical Locker. Now let's take a look at the patient timeline. Up at the top section, we have allergies, medications, and problem list. If you right-click and select Setup, you can select the items to display at the top section, the timeline, and the other sections. If you'd like to see encounters, or if your practice uses goals, you might want to select to have those display in the top section. You can also mark or unmark any items on the timeline potentially that you don't use, or move things up and down so that they are in the order that you would like to see displayed. Once you have your setup complete, hit the Save button, and the timeline will then update. The clinical messages section on the timeline will display, based on your setup, any rules for that particular patient. Let's now take a look at the timeline. Based on your setup, you would have medications, potentially immunizations, soap notes, order results, communications, any e-documents, vitals, and health exchange items will display on the timeline. Let's look at another patient that has a more robust timeline. Not only will you see the list of medications, but on the timeline, you'll be able to see the date that they were prescribed and also correlate to visits potentially and other results potentially that might have come back. From here, I can also review communications, and by hovering over, I can see the from, the to, and a subject line. The patient has any scanned documents, we'll be able to view those on the timeline, as well as any time that a vital was recorded. To open a soap note on the timeline, simply click on it, and then from here you'll be able to see the soap note, and then you'll also be able to copy that encounter forward. Please review that training for copy encounters. At the bottom left of the timeline, you'll see two icons. The first is a clipboard. If I click on the clipboard, it will allow me to view a list of the allergies, meds, problem list, as well as immunizations if those have been charted. From there, I can update the timeline or reconcile the meds, allergies, and the problem list. If for some reason a particular problem, allergen, or medication is no longer active, I can inactivate it and then hit save, and the timeline will be updated. And you'll also notice that the timeline for all of these items are marked as being reviewed today. The vitals icon will open up your vitals table screen and can be viewed either as a graph or as a table list. Next, we're going to review the right-hand side of the patient's chart. Up at the top right, you'll see an area for the patient photograph. So if you have either taken a picture or imported a patient photograph, it will display here. If you do utilize the telehealth, you'll be able to launch or start a telehealth session by clicking on this icon here. The patient AMP, which stands for allergies, meds, problem, is just a quick view of the patient's allergies, meds, and problem list, including vitals and if there are any results. The chart tab area is a list of available chart tabs in order to document on your patient. To customize your view of the chart tabs, simply right-click and hit Set Up Favorites. From here, you can unclick any of the chart tabs that you do not utilize for your practice. And you can also move items up and down to set a particular order of how they will display in your chart tab area. Once you have your customization done, simply hit the Save button and close the window, and then your chart tab display will update. Next is the quick picks. So this area allows you to add customized just notes that you can quickly add to a patient's chart. And then lastly, if your practice does utilize the E&M coding, you'll be able to view that here to help you select your E&M code. This concludes the general overview of the EMR portal. Thank you.